Welcome to The Dental Brief, the podcast that delivers actionable insights and expert strategies to help dental professionals like you grow, lead, and succeed. I'm your host, Patrick Shavasty, the president of Omni Premier Marketing. Every week at The Dental Brief, we bring you real conversations from expert speakers that offer expert advice and quick tips that make a real difference in practices nationwide. Whether you're a general dentist or run a multi-location practice, we've got you covered with content that's designed to help you attract more patients, to streamline your operations, reduce headaches in managing your practice, and increase your profitability. If you're ready to elevate your practice, be sure to subscribe, hit the notifications bell, and let's dive into today's episode of The Dental Brief. Hello, everyone. Welcome to another episode of The Dental Brief. I'm excited to have with me today's guest. It's going to be a great program. We're going to learn some things. We're going to have some fun. Without further ado, Lisa Maisonet, say hello to everyone.
Hi, nice to be here today, speaking to everyone.
Yeah, it's so good to have you here. We appreciate you taking the time. Lisa, let me just kind of jump right into your experience. You got a lot of letters after your name. You got RDH, you got BS, we've got EFDA, PhD, You've been around dental for a while. Let's start with the beginning. How'd you get involved in dentistry?
So I started at the age of 15, believe it or not, and that was back when they used to train assistants on the job. So I was a dental assistant for about 14 years and decided to go back to dental hygiene school. And I've been a hygienist now for 23 years, not working clinically anymore. Now I'm working outside of the clinic setting because unfortunately I had 2 shoulder surgeries, which kind of pulled me out of the hygiene realm. So I've been more in now major account executive role where I work with practices across the country, helping them to do well with, patient care and scale their practices.
Yep. That's awesome. And so along the way, you started, and I think it's something relatively new, the Oral Health Awareness Project. Tell me about that. What is it and what does it do?
Correct. So I've always had a lot of passion for our hygiene profession, and just recently legislation has been passed in several states that has really minimized the level of education that providers need in order to provide preventive care or services to the public. So the Oral Health Awareness Project came to life this year in June when we decided that there was a little bit of an issue in the level of education that patients have regarding dental hygiene services. So a lot of times when they think about a dental hygienist, they think about someone who cleans their teeth, right? And they don't realize the value of the life-saving services that a dental hygienist actually provides. So we decided we would start OHAP in order to educate legislators and the public on the life-saving care that a dental hygienist provides and the importance of the 3,000 plus hours of CODA accredited education that we receive. Not an easy program to get through, right? Because we have so much that we do in the dental practice. And we thought, hey, maybe if we educate the public and our legislators, they'll know the importance of not allowing for lesser education.
Yeah. Seems like it's a little bit of an uphill battle, isn't it? There's quite a few, there's a lot of dentists that are actually behind lowering some of the requirements and the standards, if you will, correct?
I agree. There are. And, our goal too is not only in protecting our educational standards, but also in pushing dental hygienists to level up the care that they provide, right? Because sometimes dentists may also feel that they have mediocre hygienists in their practice that just polish and let patients go. And, we want hygienists to know that if we start educating the public on what they should expect during a dental hygiene appointment, that they're also going to demand that. They're going to demand the oral cancer screenings, the blood pressure screenings, and that way dentists can also see the level of care that we provide is important for them. Without preventive services, their restorative services aren't going to last, right? Their crowns are going to fail if there's gum disease and bleeding. And so I feel that we work hand in hand to provide the comprehensive care that patients deserve.
Yeah, that makes sense to me. So I read your mission statement, the Oral Health Awareness Project. Let me go ahead and just read it out loud. Is that okay?
Sure.
Yeah, on your website, to safeguard the oral health of communities by increasing public awareness about the essential role of licensed dental hygienists and by advocating for policies that prevent substandard non-accredited dental care practices. Seems like a terrific mission to me, by all means. So I know that you're looking for support. Before we ask who should support you and why they should support you, what will that support do? What ultimately, how do you want to go about, and how do you plan on going about fulfilling your mission?
So the biggest support for us is all dental hygiene groups that are there to stand behind dental hygienists, whether it be the American Dental Hygiene Association. We have several alliances that have surfaced, the Florida Dental Hygiene Alliance. We have the Washington Advocacy Group. We have the Lone Star Group in Texas. So we feel that we all need to come together to provide the education that individuals need. And one of the first things that I think we need to stop doing is calling what we do a cleaning, because it's not a cleaning. We do so much more than just polish teeth. And that's the big step. We want dental hygienists that are working in clinic settings to educate their patients, to let them know that this is why it's important to come and see us, because we do provide care that can minimize the risk for Alzheimer's, cancers, heart disease. We know that there's level 8 evidence about bacteria in the mouth and arteriosclerosis. So we can't not look at everything that's out there right now and ignore that. So we feel that, it has to be a joint effort amongst
Yep.
many groups.
Yep, that makes sense to me. And I know that part of the things that you're working on is building a coalition, working on legislation. I'm assuming that's at the state level. So tell me, why should someone decide to support you? So I think there's a lot of people that are listening that are like, yeah, this seems like a pretty good thing. I'm sure there's plenty of hygienists that are listening going, yes, absolutely, 100%. Why should they open up their wallet and give money to you?
If I were to make a prediction on how much legislation is going to be introduced come February for OPAs, oral preventive assistance, and we were already told another state is going to be introducing a scaling assistant bill, and that one is just pretty much we're going to train you on the job, right? I feel for registered dental hygienists who went through 3 to 4 years, because by the time, our prerequisites are done, it's a lot more than the 2 years that we need for the associate's degree. For dental hygienists who want to safeguard, the education that they underwent and safeguard the safety of our patients, because what's going to happen when we have scaling assistants that can only scale super gingerly, and, offices are allowing this and calling it a pro fee, calling it a day, we're going to see patients with a lot more disease. And I can tell you from a perspective of my mom who has early dementia, I don't want her at the hands of someone who's not going to substantively scale if that's what she needs, because that can lead to the furthering of her dementia. So hygienists need to know that they have to support a mission that's there to educate the public in order to protect and safeguard our patients. That's really important. But not only that, to safeguard their profession, right? If this continues to pass from state to state, in 2 years, the profession as we know it is not going to be there anymore.
Yeah.
It's going to look a lot different than what we see it as now. So it's not only protecting patients, it's protecting their profession also.
Yeah, I want to be careful here, and we don't even have to, if you say, hey, this is just not a great conversation, I would totally respect that. But I kind of feel like there's a huge part of the population of this country that thinks that's what the healthcare community does, is protects its livelihood, safeguards its livelihood. I think there's a lot of people that think vaccines were created just so doctors can make, millions and millions of dollars on vaccines, which isn't the case by any means, but that's what they think. I think there's a lot of patients out there that think the same thing about dentistry, that routine cleanings aren't necessary, that fluoride is actually killing people, right? They believe that. How do you educate them? Like, how do you get them to go, hey, okay, we care about your livelihood, or we care about the quality of care that we're getting, or the lack of access to care because of those safeguards?
Yeah, and that's what we're doing with our PR company, is trying to get them to put us into not only dental publications like they connected us with you, but also into healthcare publications. And we've already had several articles that have been published in healthcare publications about the importance of the services that we provide, so patients can start learning. Because you're right, there's such a lack of education. I see it in the organization that I work in now. I work with many dental practices that do full arch dentistry because patients are coming to them with terminal dentition. And it's really sad that in today's age, with everything that we have, like you mentioned, fluoride, sealants, everything that we can give patients to prevent disease, that we're still seeing patients come in with, terminal dentition where you can't even save their teeth. So we have a lot of work to do, and we're doing press releases. We're reaching out to news agencies. And I think that's the only way that we're going to be able to get the message out, but also speaking to our own patients and saying, hey, if you have family members who haven't been to the dentist in years, maybe you share with them the value of coming to the dentist and the services that you get and the reason you are healthy because of the services that a dental hygienist can provide you.
Yeah, makes total sense to me. Lisa, I'm going to tell our listeners one more time, check it out, oralhealthawarenessproject.org. Good for you for believing in something and going after it, right? Standing up for what you believe.
I appreciate you having me on and allowing us to share our mission and the importance of what we're doing, because it really is, first and foremost for the protection of our patients.
Awesome. Lisa, thank you so much for your time, and we want you to come back on. Thank you.
Awesome. Thank you.
Thanks for listening to this episode of The Dental Brief. If you found it helpful, give it a thumbs up, subscribe to the channel, and share it with a colleague who could benefit. We're here to help dental professionals like you stay ahead of the curve, one brief episode at a time. You can find more episodes and resources at thedentalbrief.com. You can also join the Growth-Minded Dentist community on Facebook. Links are in the description. Until next time, keep learning, keep growing, and thanks for being part of the Dental Brief community.